To our breaking news out of Ontario now, the province is reporting 615 new COVID-19 cases today. Locally, there are 289 cases in Toronto, 88 in Peel, and 81 in Ottawa. 58% of the cases are in people under the age of 40, and nearly 38,200 tests were completed. CTV's Colin D'Mello joins me now with more. Colin, of course, covers Queen's Park and Premier Ford. What do we make of today's numbers, Colin?
Well, you know, it might be down from what our peak was, Marcia, but nonetheless, the 7-day moving average is still on an upward trajectory. And in fact, if you take a look at some of the moving averages from today, you compare them to the first wave, we are already above the peak of the first wave. So, this is already signifying that this is going to be bad, and it could even get worse coming up. But the key here that I think a lot of people are wondering is, what are the numbers going to look like in the future? Because the testing strategy in this province is changing. The assessment centers in this province, 153 of them, are going from a walk-in basis to an appointment-only basis. So that means there are going to be thousands of people, tens of thousands of people, who might not be able to get a test in the days to come because they have to wait for an appointment. So there are a lot of doctors wondering what kind of an impact that's going to have on the numbers going forward. But all eyes are also on the province now because the city of Toronto is in a really bad state. They're asking the province to impose more restrictions, such as shutting down indoor dining in restaurants, and they're asking them to officially put a moratorium on Thanksgiving so that they can keep schools open and keep other parts of the economy open. We'll see today how the province responds.
Okay, of course, we'll be watching for that. Colin D'Mello, as always, thank you for that. Appreciate it. I want to turn now to Dr. Sumon Chakrabarti. He's an infectious disease specialist. Doctor, good morning to you. So, the trend continues, as Colin D'Mello just reported, 615 new cases today in Ontario. What do you think?
Actually, this is a big thing to consider now, because the numbers as it was, you have to be careful about putting these into context. But now they're not going to be likely as reliable, because as now the testing has been restricted, as Colin was mentioning, we're not going to be seeing as much of the iceberg as we were seeing over the last couple of months. So that means even if you start to see a dip, it's not really reliable, and you have to kind of assume that we're still seeing this increase in the background trajectory of cases from before. And I do suspect that at this point now, especially because Toronto Public Health has stopped with contact tracing for the time being, that we might see some more blunt tools used to try to help bring this transmission down.
Okay, well, what do you think about moving to appointment only for a test? Is it the right move? We all understand what a backlog is. So is this the right way to address this problem?
This is unfortunately a downstream effect of what, in my opinion, was a bad policy to begin with in the summertime, when we were just letting anybody who wanted a test come to get one. This is an effort to try to correct that, to try to get the people who are indicated for testing. So, for example, new symptoms such as cough, fever, or a high-risk contact. It's, of course, imperfect, because now you have lots of people who might say, well, I'm just not going to get a test because I can't get an appointment. All of these things are going to be part in play. It's a very difficult situation. I think right now, the main goal is going to be to get these cases back in control, and then have a strategy going forward for more, effective testing and effective contact tracing.